Good afternoon, it's Mark Polenkars with today's coronavirus COVID-19 outbreak briefing for local media as well as those that are watching live on my Facebook Live County Executive page. Thank you for participating once again as we give an update with regards to issues associated with COVID-19 in our community. It is just myself and Kendra from Deaf Access Services. Dr. Burstein is off today in observance of Passover, so I want to wish all those of the Jewish faith a happy Passover and a wonderful, as good as wonderful possible Seder as you can have. The doctor and I were talking last night. She said it's probably the most different Seder she'll ever have been at because everyone will be separate and it'll be in a Zoom meeting as compared to people coming together. And I've attended Seders before where people come together and celebrate the passage of the Israelites from the Egyptians 2,000 years ago, but unfortunately people will not be in a room doing that today. So I want to thank each and every one of those who are following proper social distancing guidelines with regards to the observance of Seders for Passover. As usual, the information in the PowerPoint presentation you will see is only as current as the date of the presentation. Unless otherwise noted, the situation does evolve rapidly, and for the latest numbers and guidance, we recommend that you go to our websites, as well as throughout the day, check our COVID interactive map at erie.gov/COVID map, or the COVID page, which is erie.gov/COVID-19. As of 1:30 today, there were 1,335 total positive cases for all labs. We have increased on a regular basis, at least over 100 cases it seems like each day. Unfortunately, I have to announce that 45 people have now died as a result of COVID-19 and the contraction of the coronavirus, and I do offer my deepest sympathies and condolences to all who've lost a loved one. This is 6 more than yesterday when we announced we had 39, and we expect, based on what we're seeing from cases that are growing in the ICUs and ICU airway assist, that we may see additional ones as well. Hopefully the sound was working. There seems to have been a little issue. Is the sound working? It appears to be working. Okay. But yes, 45 people have died in Erie County as a result of COVID-19. Those are residents. Those are not the number of individuals who may have died in a hospital. There are a few others who died in Erie County hospitals that are residents of other counties in western New York, but those are 45 Erie County residents. And once again, I offer my deepest condolences to the family and friends of those who perished. There have been some questions regarding mortality and the racial breakdown. So we were able to go in and get information on these 45 individuals. And in Erie County that have passed, 30 of them are identified as white. And 15, I'm not exactly certain what you're saying. You got to say it, Monica?
You move the mic.
Oh, I need to move the mic a little closer. Okay. Try to move the mic a little closer. Is that a little better, hopefully? Are we getting better sound? Does it sound better? Well, I think that's about as good as we're going to get without me shouting. But there are 45 individuals who have passed as a result of the COVID-19 in Erie County. 30 of them identify as white, 15 black/African American. And that is the report for today. We are trying to keep that updated as much as we possibly can. It does require our staff to go in and do research on the individuals. We have been able to do that, and I thank the staff and the epidemiologists in the Department of Health who've been able to keep up with that breakdown. 333 people have recovered. Good sign that we have seen. People have recovered, and there's more people who've recovered than have perished. 957 people are currently in isolation, which includes individuals at home as well as in hospital. So we wish our best to those who are currently active cases and are in the process of dealing with the contraction of the coronavirus and COVID-19. And then as of yesterday's report, which is actually for the day before, so this would not be for yesterday, but for today is Wednesday, I believe, so it would be for Monday. There were 221 individuals who are hospitalized. Of those, 119 were in the intensive care unit, and of those 119, 113 of those had an airway assist. So a high proportion. almost 100%, about 95%. Here's the latest hospitalization chart. And we did have the drop that we reported yesterday, but we were not necessarily feeling that that drop was going to continue, and today's numbers confirm that. Hospitalization of patients continue to grow. Approximately 50% of all patients are in the intensive care unit, and on average 95% of patients in the intensive care unit require an airway assist of some type. So we do have our thoughts and prayers out for those individuals who are dealing with COVID-19, especially those that are in the ICU, because they're in a very precarious situation. But this is the highest number of hospitalizations we've had, 221, the highest number of people in the ICU as well as requiring airway assist. So I wanted to talk a little bit about that because we know the governor's been talking about the reduction in hospitalizations, but he's talking about statewide. And while we are seeing at least not tremendous exponential growth, we are still seeing more people on a daily basis on average going into the hospital and being hospitalized for COVID-19. We're hopeful we get to a point where that blue line continues to drop. We did have the one-day anomaly, but we actually thought that was more a result of unfortunate deaths than anything else. And we do see a continued growth, though the growth is not to the same level as we see of new cases. But considering we're seeing growth in cases, we are concerned that the hospitalization numbers will continue to grow themselves. Cases by age and gender, this as of today with 1,335 cases. There are more females at 691 than there are males at 644. The difference in the ages of 50 and below is it's generally more females in every category. We believe that's also because of individuals who are out as essential workers who may be contracting this, including in healthcare locations, as well as even grocery stores. So we are concerned about that. And then you see in the 50 and above category, in the 50 to 59, 60 to 69, 70 to 79, there are more males than females. Though in the 80 and above, there are more females. But overall, there are more females that are contracting this, and we want people to understand it really doesn't matter what your age is, your gender, your race, your religion. Everyone can contract COVID-19, and we're seeing that because every town, every city in Erie County has a case, and we want people to understand that the best way to avoid contracting COVID-19 is to stay at home and to not go out and put yourself at risk by seeing other individuals that you have not come in contact with. Flattening the curve. We talked about this yesterday with regards to the modeling, and what I was surprised, because we talked about it a lot in the beginning, was what flattening the curve means. Flattening the curve means reducing the number of individuals who catch COVID-19 and require hospitalization at the same time. If we did nothing, which is the top curve, which is the higher one with a little red tint to it, we would have a tremendous amount of cases and a tremendous amount of individuals who required hospitalization in a very short period of time. That's the worst case scenario. When I talked about a worst case scenario with over 10,000 hospitalizations for Western New York, because the modeling we've looked at, which has been performed by individuals at the University of Buffalo, is modeling that looks at all of Western New York, the 8 Western New York counties, and 1.5 million people, not just Erie County. But the modeling talks about if we stopped social distancing, we would see a big peak at the end of this month, and it would not be something we can handle. Now, you flatten the curve, and what it does is it takes us longer to get out of it, but it also reduces the number of individuals who contract it, who need hospitalization at any one moment. So while you may still have the same amount of contraction among the population, it's just over a different time period, and it reduces the need to have so many people go to the hospital at the same time, therefore allowing us to control it more. And we talked about hospitalization beds. You see, you wouldn't have as many people have it, so you wouldn't need as many hospital beds at the same time, and you could reduce the hospitalization numbers at any one time by thousands. So flattening the curve is not to shorten the process. So it's what it is, it's to reduce the number of people who get it at the same time, and therefore reduce the demand and need for hospitalization at the same time. That way our hospitals we stop them from being overrun, which is what our biggest concern is and what the big concern, of course, the governor had statewide. So when it comes to the modeling and what the governor was talking about with regards to peak, he's generally been talking about New York State as a whole, but because New York City dominates it with so many cases, as long as Long Island and Westchester, it skews things. We know we haven't reached our peak yet. It's as simple as that. We have modeling from the University of Buffalo. We have modeling from other locations too that shows our peak number of cases and our peak hospitalization is still weeks off. What day it is, I can't say. I don't know. We do know if we don't flatten the curve, if we just went back to everything is normal, and we don't practice good social distancing, we'll have that peak much sooner. There'll be many, many, many more people across Western New York who will contract it, who will need hospitalization, and many more people who will die. So we need to continue to practice smart, safe social distancing, be physically distant from people that we haven't been around, so that we can flatten that curve, reduce the need for hospitals in a short period of time. There are still a lot of people who are going to contract COVID-19, but this allows us to be able to handle it better. So I wanted to clear that up with regards to flattening the curve. For whatever reason, there seemed to be some thought that flattening the curve meant that we just move things quicker. That's not the case. It'll take a little longer, but it'll save lives as a result of it. The mapping. Erie County has its case mapping, of course, at erie.gov/COVID map. New York State has a case map as well, and you see the latest numbers from New York State. 365,000 people have been tested. 149,000 are positive, and of course we have a little over 1,300 in Erie County, and our numbers continue to grow. We are now one of the orange areas on the map because we have over 1,000 people who tested positive in Erie County, so our numbers are growing, and we are passing on information as we get it from New York State, and they're sharing information with us as well. Now the case mapping also, in the local has a zip code feature. And I want to talk about zip codes because zip code mapping is not an apples-to-apples comparison. A lot of people are a little confused or not concerned because, hey, my zip code doesn't have a whole lot of people in it, or my zip code has a lot. What does it mean? I want to remind everybody, zip codes are postal codes. It's not based on an even number of population. I'll give you an example. 14219 has the most cases at 100 with a 39,999 population, or a 0.0025 contraction rate per resident. So it has the most cases, and we are very worried about individuals on the east side of Buffalo because of health disparities that exist. So we are concerned. We're working with our healthcare partners on that. But it does not necessarily mean it has the highest rate of contraction, because 14209, which is actually where I live in the city of Buffalo, has 33 cases. You look at that and say, wow, it's not that bad. But it only has 7,926 residents as of the last census. So its actual contraction rate is higher at 0.0042. So just because your zip code has one number or another, and you look at it and compare it to another one, it's tough to do it. It's not an apples-to-apples comparison. And it also has a lot to do with testing. It's possible that one zip code has had more tests than other zip codes, and therefore their numbers are higher as a percentage of their population. It's very difficult because it's constantly changing, and we don't always get the most accurate information with regards to all of this. Remember, we had a problem in the one zip code map in which they superimposed a number, and then Kenmore was off as well as Orchard Park. So we want people to understand that we are concerned about certain areas of the county where there seems to be a greater propensity for cases, but just looking at the zip code alone does not tell you the true story. It provides an idea of what's happening on the ground, but it is not exact. So I wanted that to be known because we had a lot of questions, and we also got calls from people saying, oh, I've only got 15 cases in my zip code. That means I'm safe. I can do whatever I want. And the answer is no. We need you to follow proper social distancing guidelines. And those 15 cases might actually put you in the top 20 zip codes in Erie County if you just don't have a whole lot of people that live in your zip code. So I want people to understand that it's not an exact science. We did it because there was a request, and we wanted people to see, and it gives us an idea of what's happening on the ground in those neighborhoods, but zip codes can vary dramatically based on the population in that zip code as well as how many people have been tested. We've received a lot of donations in Erie County government for some food, of course, for staff, but PPEs and other things that are helping in the COVID-19 effort. So I wanted to particularly today give a shout out to a number of those who've donated. If you're not on the screen and you did donate, I apologize. This was compiled by my staff, but we'll try to get everybody listed. But Blue Cross Blue Shield, Buffalo Public Schools, Clarence Central Schools, Erie Bose's, Lenova Pizza, Orchard Park Country Club, Precision Scale and Balance, Spectrum Landscaping, Spinebeck, Texas Roadhouse, Lamar Advertising, and then Kathy Conklin, Daniel Peck, and Ben Stilson have all donated, whether it's food or PPEs and other equipment to Erie County government. I want to thank you. I know a lot of others have given donations to other organizations, especially PPEs to healthcare organizations. Thank you very much on behalf of all of us in Erie County government. Now today, I am proud to announce the beginning of our Erie County Business Task Force. I know we talked about this in the past, but today we're actually going to officially roll it out. I charge the steering committee made up of representatives from Erie County, the Buffalo-Niagara Partnership, the Erie County Industrial Development Agency, as well as the Buffalo and Erie County Workforce Investment Board, to create a task force involving a mix of government, economic development organizations, and businesses to establish ways our community can work together to help our local businesses through these difficult times. The task force objectives were simple: immediate and targeted business assistance to local businesses, to come up with short and long-term policy and procedural recommendations at the local, state, and federal levels, and to identify the workforce businesses needed to succeed in a present and post-COVID-19 economy. So it's not like we're going to be looking at everything associated with the economy and the business community, but we're looking what we need to do to help businesses today and also to sustain businesses in the future. The membership, there are two different types of ways of doing it. With businesses themselves, including essential and non-essential businesses, large and small businesses, minority and women-owned businesses. We looked at a mix of the business sector, and we also had union and non-union workforces when it pertained to the business task force membership. And then we also had organizations, which include government, chambers of commerce, local and regional economic development organizations, those in organized labor, small business, the workforce development organization, very important that we find people for these jobs that do exist and also help people get trained for jobs that may exist in the future, as well as local economists. The task force members, our co-chairs, are Scott Pallotta, the CEO of Zender Rittling, who's also the chair of the Buffalo-Niagara Partnership Manufacturing Council, and is a board member of the Workforce Investment Board. I talked to Scott earlier today, and I thanked him for his participation as co-chair of this task force. You'll hear a message from Scott in just a moment. We also have as a co-chair Brenda McDuffie, who is the president and CEO of the Buffalo Urban League, as well as the president and chair, the chair, not the president, the chair of the Erie County Industrial Development Agency. Is also a council member on the Regional Economic Development Council and the board member at the Workforce Investment Board too. I spoke to Brenda before today's presentation, and I thank her as well. As also offer my condolences to Brenda, who lost a loved one in just the last 24 hours as a result of COVID-19. It's touching a lot of lives, and no one's immune from it. So I want to thank Scott and Brenda for their agreement to co-chair this task force. And at this time, I'm going to pull up a little talk from Scott. I'm going to move this so we have an opportunity to hear from Scott as a member of our business task force.
Hi, I'm Scott Pallotta, CEO of Zender Rittling, a manufacturer of HVAC equipment based in South Buffalo. I also serve on the board of directors of the Workforce Investment Board, am chair of the Buffalo-Niagara Partnership's Manufacturing Council, and a SCORE volunteer. I am truly honored that the county executive has asked me to serve as co-chair with Brenda on this important task force. All of us have been affected by the coronavirus. Our goal is to help businesses navigate these uncertain times such that they're able to reopen or get back up to full speed once it is safe to do so. We've assembled a great team of both public sector and private sector leaders who will be reaching out to businesses across Western New York for input. I look forward to these conversations and to recommending meaningful action. We will get business back up and running and our employees back to work again, making Western New York stronger and better than ever. Thank you, and please be safe.
Thank you, Scott, for that message, and I certainly appreciate your work in the past on behalf of a number of organizations, including the Partnerships Manufacturing Council and the Workforce Investment Board. And I know him and Brenda are going to put together and work, I should say, we've already put together, and I'll announce a little bit of that soon, but they were going to work very hard over the next few weeks to do our best to create a sustainable environment for our local business community. The task force members are representatives of various organizations in the governmental field, and this is the government organizations. I don't want to go through every single one, but there are individuals from all these organizations. I specifically do want to point out and thank Mayor Brown. His team has been intimately involved behind the scenes with regards to the creation of the Erie County Business Task Force, and they will have a key role. But we have lots of organizations that are representing various portions of our business community. To the media members, you will be receiving a press release which identifies the exact individuals from all those organizations. So I just wanted to note and thank each of those organizations for their participation through their members. And the same thing with businesses. We have a lot of businesses, some well-known Buffalo-based names that are participating. And I want to thank Renee Jones from M&T for the work that I know his team will be putting together and helping us with regards to the economists, as well as participants on the task force. So thank you, Renee, for your great work that you've been doing to support our local businesses and all these organizations that you see here. We both have the grocers. We think it's very important this time, too. The grocers play a role, so Tops and Wegmans both have a key role, as well as others in the healthcare field and other areas, including small business. So thank you to all who've agreed to participate. Once again, the members will be identified on our website as well as to the media through a press release, so to see the exact individuals. The immediate actions. The ECIDA, through its RDC, which is a development corp, has activated its disaster relief loan program for small businesses. This is a loan program that we created in 2014 as a result of the superstorm that hit in November. The total loan fund has $2 million that's available, and $500,000 has been carved out for retail businesses, which allows for loan amounts of up to $50,000, starting at $10,000 to $50,000. Because this is a federal loan fund, we do have to charge an interest rate. The interest rate is the lowest allowable under the federal regulations, which is 2.5%, but it does allow for up to 12 months of interest-only payments. If you're a small business, I know many of them are applying through the SBA as well as their local bank for loans. This is in addition to, it supplements, but it can also be freestanding if you are not and don't qualify for whatever reason for the federal program. You should always go through your bank for the federal program. You should do the same if possible here, but this you can do on your own. You don't have to go through your bank if you don't need to. You can actually apply by calling the ECIDA. You can contact at 716-856-6525, or you can visit the website at ecidany.com, and the information you can find for applying for this disaster relief loan program through the IDA is there. We have also reached out to existing loan clients through the ECIDA RDC to provide relief during this period. We understand that many of them have loans that are outstanding. We understand they may not be able to make the payments at this time, so we are allowing for deferred payments or adjusted loan terms during the current crisis. And ECIDA, of course, we have tax incentive clients that have agreed to a number of policies, including recapture with the number of jobs that are created and have to be maintained. We will not be penalizing any company during this period for the workforce restrictions and policy that regarding recapture. We don't think it would be fair because we know a lot of businesses have had to lay off staff or reduce their staff. So we will not be enforcing the recapture policy at this time. We are also working through the ECIDA and others with the New York State Economic Development Council to seek emergency executive order so that the industrial development agencies in Erie County, and there are 6 of them, although the IDA is through Erie County is the largest, may provide expedited direct lending assistance to qualified COVID impact businesses wherever possible. There are restrictions on what we can do through the ECIDA. The RDC, less so. I know these are a lot of acronyms. The people in the business community will probably know what I'm talking about. But the IDA is restricted from giving direct loans itself, but our Regional Development Council, the RDC, can. And so what we want people to understand is we are using all of our tools in our tool belt at this moment to help strengthen our economy, including the loan program that we can go through with the RDC. And we're trying to get New York to allow us to do additional work through the Erie County Industrial Development Agency and all development agencies, but there are limitations in place right now. This is something that will be starting next Tuesday, which is a launch of a Western New York COVID-19 Business Impact Survey. The survey will assess COVID-19 impact on Western New York businesses and inform the public and private sector how we can work together to address the potential gaps that exist in available resources. Dottie Gallagher, the president from the Buffalo-Niagara Partnership, will join me next week to provide more information on this. But the task force will be launching the survey next Tuesday and getting information from local businesses so that we can take their information and the assistance they need, the help they need, and better tailor our response to this crisis as it pertains to our economy and local businesses. SBA loans, I already talked about it, but they are available now. SBA loans, you're interested, you should go to the SBA website and contact the local office. Generally, most SBA loans have to be through a bank. You can't, so you also should contact your banker. But you can go to www.sba.gov/ny/Buffalo or call the local office at 716-551-4301. There's also a SBA National Customer Service Call Center, which is actually located in Buffalo. So there's Buffalonians and Erie County residents who are working, answering these phone calls. And you can call that number as well at 1-800-659-2955. SBA loans are available through the government's recent package, but you also are required to have bank participation, so you should be contacting your local banker as well. The COVID-19 call center, the hotline 858-2929. I've checked it at various times. Sometimes it's exceptionally busy. Other times it's not. There's high call volume, so you should expect waits. Do not give hypothetical questions, as we talked about. There's lots of information online, including the federal CDC page at coronavirus.gov. So we want everyone to take advantage of those resources. If you have a question that is not directly related to healthcare, but is more service-oriented in the city of Buffalo, you can call 311. In the rest of the county, call 211. And I want to thank everyone for following those guidelines. It helps us handle the call flow that we receive. If we don't get questions regarding garbage pickup or complaints about a neighbor's dog, you call a different number. So I'm thankful that we've been able to reduce the number of calls to the hotline from a standpoint of non-healthcare calls. If you have a healthcare-related call, please call 716-858-2929. Once again, our website, COVID-19, back at erie.gov/COVID-19, and the COVID map is erie.gov/COVID map. We'll take a look at that in a second. Once again, I want to wish everyone in the Jewish faith a happy Passover. I hope you have the best Seder you can have possible with family members that we know are spread out, and you're doing it through Zoom meetings and the like. And I thank you for following proper guidelines with regards to physical distancing and following smart social distancing guidelines. It's really important. That's how we're going to flatten the curve, or continue to flatten the curve, I should say. But to all that are celebrating, may you have a happy Passover, and in this very, very important week for many religions. So with that, we'll take a quick look at the COVID map, which once again, I don't think there's been any changes since we started. Whoa, that's probably blinding everyone on TV now. 1,335 cases, 957 active cases, 333 recovered. So best wishes and congratulations to those who recovered. certainly our thoughts and prayers to those that are in active cases. 221 individuals, as I noted earlier, are hospitalized, and unfortunately there have been 45 deaths as a result of COVID-19 in our community, and we offer our deepest condolences to each of the individuals who have unfortunately lost a loved one as a result of the COVID-19. With that, I will open it up to questions of members of the media. So if you can open up the lines, Daniel. Get the lines opened, and we will start, and we'll do a little, I think we started at AP yesterday, so we'll start from the bottom with television stations, and we'll start with WKBW TV in Madison Carter. Madison.
Hey, Mark. First off, I just want
Oop, let me just increase this. Okay, can you start again?
Okay.
Okay, go ahead, start again.
First, I just want to say thanks to you and the epidemiology team for really working hard to get us some of those numbers. I know it's really helping illustrate this for a lot of the residents. I just got off the phone with Mayor Brown, who says that you and he have been in communication every day, and you've been really responsive to some of the needs of the city, especially when it comes to the African American Health Equity Task Force. And he said a big part of that was why we got the zip code breakdown. So can you just share with us some of the other things that maybe are being asked of you from that task force? What are people saying they need specifically in some of those harder hit areas?
Well, thank you, Madison. We are dealing with pretty much the same things across the county, except for a while now we've been dealing with health inequities on the east and west sides of the city of Buffalo. We've been aware of it. That's why we've put additional funds in. I'm just going to lower this a little. That's why we put additional funds in the budget to address poverty issues, as well as the cancer cluster on the east side of Buffalo and the west side of Cheektowaga. I have been in touch with Reverend Nicholas, Reverend Pointer, and others. We have talked. They have a proposal to take advantage of funds associated with the Millennium Health Collaborative. I do support it, but I don't control it. What we're trying to do is increase testing for all county residents, and we have been able to acquire more testing kits from New York State, and as the doctor noted yesterday, there were slight changes to the protocol, but we don't have tens of thousands of testing kits. We've got more, which is good, but we do not have enough to be able to test everybody who wants it. So what we're continuing to doing is focusing in key areas: healthcare professionals, those that are law enforcement, first responders, others that are entering hospitals, of course, as inpatients are being tested. We're also focusing as well on nursing homes. We're concerned about some of the nursing home numbers that we've seen and have been reported on by local media. But I have been in touch with the Healthcare Inequities Task Force. We have talked. It's part of our Live Well Erie plan. I know you're aware of the Live Well Erie plan, which is to address inequities associated with healthcare provisions across our community by going after the social determinants of health, which often drive the individual's healthcare needs. So we've been focusing on that for quite some time now. We've been focusing on a number of things, starting out with my initiatives for a stronger community plan approximately 5 years ago. And we moved that into the Live Well Erie plan, which we officially announced and rolled out last year. I didn't think we'd be in a situation today where we'd have to sort of speed up some of those things, but we're trying it as best as we can. We're a twofold problem right now in Erie County government. We're spending a lot of money in response, including trying to spend as much as we can by legitimately getting PPEs, and there's a huge fight, as we all know, across the world right now for PPEs, nevertheless the country in this region. At the same time, we're seeing decreased revenues, and why we've had to shut down some of our programs, though we are still paying all of our employees at this moment. We are very concerned. We're going to see a huge drop in revenues in the second quarter. We have not received the federal funds yet. So right now we're kind of playing not on a shoestring budget, but we're certainly concerned about how much we can spend at this time with the declining revenues. We have been approved for $160 million in federal aid, but we have not received it yet. So until we receive that, we have a limitation on what we can do. But our goal is to work with our partners like the Health Disparity Task Force to address the issues. They are looking to support a project at the Millennium Health Collaborative, funding it. I certainly support their initiatives. But we also are working to ensure that everyone across Erie County gets the treatment that they deserve. And it just happens to be that there are more individuals on the east side of Buffalo, west part of Cheektowaga and the like, that are in need because they may not have a health care provider and the like, and we're working with our partners to try to alleviate that. Next question to Kelsey Anderson of WIVB TV, and let me increase this again so people can hear you, Kelsey.
Hi, Mark. Hi.
Yes.
So I saw your tweet earlier that said people in Erie County may not be social distancing well enough. I'm wondering at this point if you're thinking of closing any of the county parks or doing anything to further help, flatten the curve.
Well, part of the problem is there's only so much the county can do because it requires everyone to follow proper guidelines. As we talked about before, most of our parks are being underused. It's as simple as that. There are a couple key parks that have been used a lot. Chestnut Ridge Park is one, Como Park in Lancaster. We've heard of increased numbers at Ellicott Creek Park in Tonawanda, but those are just three of many, many parks we have. I'm trying not to close the parks. We're looking at alternatives, including limiting the number of vehicles that may come into the parks, but then people will just park along the side of the road, especially in a Chestnut Ridge Park where it's so huge and it has multiple entrances. So we're trying to come up with alternatives to limit a lot of people being in one location. Chestnut Ridge is a huge park. It's over 1,200 acres. You could actually put every single city Olmsted Park in Chestnut Ridge and still have 200 acres left over. The problem isn't Chestnut Ridge Park per se. The problem is everyone going to one section of Chestnut Ridge Park. So if everyone's spread out, it would probably be okay. We are concerned. I know, having talked with other supervisors and city mayors, they're concerned as well because there's certain parks that are very busy. We know we have to have outdoor activity for people, especially as the weather's getting better. So just shutting down the parks won't prevent people from going out. What we're asking is if you do go out, you practice proper social distancing. You don't need to go to that ride for Target or Lowe's or even Wegmans if you don't have needs. People are going out to stores just because they're bored and they want to get out of the house. I get it. But it doesn't help when you're exposing yourself. And remember, we're also recommending now when people go out, you should be wearing a mask because you don't know who you're going to come in contact with. We are aware of individuals from varying professions having COVID-19. We've seen the stories now. I don't know of anybody locally, but we've seen the stories of individuals that work in groceries and supermarkets who have unfortunately perished from COVID-19. So when you go out in public, you're putting yourself at risk. The best way to do it is to avoid going out in public. Steve Brown from WGRZ TV. Stephen, are you there? Is there anybody there from Channel 2?
Hello.
Hi, can you identify yourself? Okay, go ahead. Channel 2, it's your time.
All right. Hi, it's Kelly from Channel 2. So as the county gets more testing kits, when do you add those essential workers who are on the front lines, like the people working at the grocery stores who are keeping us all fed, to the list of people who will get tested?
I'd really have to defer to the health department. I know we have guidance from the New York State Department of Health. We are required when we find an individual is positive, we have to contact trace them. We do have nurses and others from our health department having conversations with them. We are very worried about having hundreds and hundreds or thousands of more of cases of being able to do proper contact tracing. But we are continuing to increase testing. I think it's been noticeable. I've released some data at the end of each day showing that we have increased testing. So I'm not the one who makes that call, Kelly. It's really the health department that makes that call. And our goal is to ensure that those that are at risk get tested. If there is somebody who works in a setting that is in the public and they are showing the signs of COVID-19, first off, they shouldn't go to work. You should stay home, and you got to contact your doctor and have your doctor contact us. That's the best way to prevent the further spread. So no matter where you're working, whether it's a supermarket or a hospital or a nursing home, if you're sick, you should not go into work. And the same goes for government. We've had to send a couple people home. That hasn't happened in a week now, but I'm glad it hasn't. But we've had to send people home who are sick, and you should contact your doctor, and then your doctor would get in touch with our public health department to determine whether it's appropriate to have that person tested. WBFO, we have WBFO today. Michael Moroziak. Michael.
Mr. Poloncarz, how are you doing, sir?
I'm doing good, Michael.
Okay. My question is this. Earlier this week, you posted some contact information for those who wish to complain about people violating physical distancing guidelines and social gatherings. You also posted some information for businesses that may be operating that shouldn't be. Have you received any complaints this week of other businesses in addition to the 2 bars that recently had their licenses stripped? Have you heard any further complaints about businesses operating that should not be?
The answer is yes. We've had quite a few. We pass those on to the appropriate resource. The Erie County Department of Health, working with local law enforcement, will go to those that we have power over, such as bars, restaurants, anything that has a license from Erie County. Those that do not have a license per se, but maybe businesses that are non-essential that are operating, that information is being passed on to the local town or city, in which then they go out there with code enforcement or law enforcement, and they can penalize those individuals. I do know that happened in the town of Amherst. I do know that happened in the town of Tonawanda. I know Lancaster. I was on phone with Supervisor Ron Ruffino, and they said that they were going to enforce, just like Brian Culpa in Amherst did, and Joe Eminger in Tonawanda, and Mayor Brown in the city of Buffalo. So if you are a non-essential business and you're operating, you may find yourself under the gun of law enforcement penalizing you for your operation. The 800 number that I previously showed it goes to New York State. That information from New York State is then shared with the local government that's appropriate. We get some of the information, we don't get all of it, but I do know that there are a lot of complaints that have come in to New York State, and just as, I don't know about just as many, but we've received quite a few of them as well, and then we pass them on to the appropriate local agency. Spectrum Buffalo, with Aaron and Sarah.
Yep. Hi, Mark. Just wanted to circle back to the social distancing numbers that our grade went down. Do you think that these databases tracking people's phones for this are useful or an invasion, or like, are they helping us?
I think a lot of people are surprised to find out that they can track their phones, but yes, you're basically are being tracked at all times when you're using your phones, and that data is shared with a lot of folks. That's why when you're driving around in a particular location, you can get an ad that pops up on your phone for the restaurant or the business that you just happen to be by. That's how they're doing things today, and I think a lot of people are shocked to find that out. I think these websites are helpful. They have showed us that at various times we've done better at social distancing with less people traveling, less people out. Actually, there was an update on the one site that I talked about earlier today, which actually had us a little better now, because it seems like people in the last 36 hours are doing better at social distancing than they were in the period before. But I still know we were doing better about a week to 10 days ago with regards to just overall travel. It helps, and it shows us the number of people that are traveling as compared to the average and what it was before. I think a lot of people, as I've said, are shocked to find out that everywhere you go with your phone, as long as it's hooked up to the system, they're tracking it, and they can see where you're traveling, and that information is then shared with advertisers. But we want people to understand that the best way to avoid having your phone being tracked as you travel is to turn your phone off and stay home. Stay home, put your phone on, that's okay. But I would suggest that people just, if you don't need to, if you don't have an essential reason to be out, stay home. If you're going to the park, do it, but you got to do it in such a manner where you're not engaging with other people, and then everyone will be safe. Investigative post, Allie Ingersoll. Allie, are you there? I guess not. Sandy from the Buffalo News, Sandra Tan. Sandra? Sandra? Might be there. Okay, B News, Ethan Powers. Ethan's not there anymore? Yep, enough. Okay, we'll go back to the bottom then, and we'll start once again. Madison with WKBW.
I'm all set. Thank you so much.
Okay, thank you, Madison. WIVB, Kelsey, do you have any other questions?
Just quick about the plastic bag ban that we saw happening before all of this kind of began. Are we kind of ditching that effort now to get through this, or not necessarily?
The bag ban is still technically in effect. However, I don't believe New York State is enforcing it at this point. I'm still bringing reusable bags. I can actually, my bags that I have are washable. Oops, let me lower that. I've actually thrown my bags in the washer after every time I've used them and quickly throw them in the dryer. They dry up nicely, they're clean. But it's my understanding New York is no longer enforcing the bag ban. Channel 2, we had Kelly Dudzik and Steve Brown. Either of you have a question left?
No, I'm good. I'm good. Thank you.
Okay. Stephen, are you fine? Guess he's gone. Mike Mroziak? WBFO?
I'm good. I'm good.
All right. Is anybody on from WBEN?
Yes, Mike Baggerman here.
Hi, Michael.
Mark, we've been getting reports that there are a lot of people who are taking a NFTA Metro bus that are considered non-essential. A lot of it has to do with the fact that getting on the bus is free nowadays. Is there any effort that your office has made to pressure New York State to try to have them collect a fare anytime they want to take a bus into the city or around the city?
I did talk to Kim Minkle, the director of the NFTA, last week. I think it was Friday. About this particular issue because we were getting reports that kids were getting on the bus and just sort of joyriding. Kim said based on their own data analytics that 98% of the individuals that were on the bus were legitimately going to and from work or on legitimate business, so to speak. They weren't just joyriders. I have heard the same as you're reporting. I'll have to check with the NFTA. Last week they felt that it was manageable. I don't know if there's been a change. I'll have to contact them and find out. But as of last week when I spoke to them, it was less of a concern. I'll just have to find out if they think it's more of a concern, and if so, then appropriate action will have to be taken. Spectrum News?
We're all good, thanks, Mark.
Okay. Investigative Post, anybody still on? Nope. Buffalo News? Sandra, are you there?
Hello.
Okay.
Can you hear me?
Yes.
Okay, sorry about that. So we have appreciated all of the information that the county has provided regarding confirmed cases, the breakdown in terms of zip codes and
Sandra?
Hello?
It sounds like you
I'm
got
still
a.
here.
It sounds like you got a vacuum there. Are you on speakerphone or are you on regular phone? Okay, go ahead. Try again. We'll come back to you in a second then. B News.
Sorry about that earlier. Football as well. I know that you've taken a couple questions about this already, but I wanted to just ask briefly about that social mobility data from Unicast. It seems that our data in Erie County kind of fluctuates heavily from day to day when you would expect it to remain, relatively stagnant during social distancing. From your perspective and that of local government, do you have any indication as to fluctuation of county residents traveling from day to day?
Yes, we've certainly gotten reports from local law enforcement, though, that there are some days that are much more busier than others, and not surprisingly, it's when the weather's nice. When the weather's nicer, more people are out, more people are going to parks, more people are going to shop. They may be going for essential services or not. We have been in touch with local law enforcement and local leaders about this. There has been concern about certain locations that are overly busy than they should be, including like Home Depot or Lowe's. I would just recommend to people that you only go out when you need to go out. I understand if you want to go for a walk, that's fine, but do it smartly. We've heard stories of basketball games that were going on, of kids in the neighborhood, and there are children that are catching COVID-19. They may be fine. They may not realize any results, but they could take it home and take it to their parents or their grandparents. So we do know that we're seeing movement generally on the days that are a little nicer out, and with the weather getting better, we are worried that many, many more people will want to continue to get out. We have not reached our peak yet. We don't think our peak is until weeks away. We have been able to flatten the curve, but if we stop flattening the curve by just going out, we're going to have a huge peak early on that's going to basically suffocate our hospitals. That's why we need to continue following these proper physical distancing guidelines. And we will be watching the sites to see how our social distancing compares to others. Sandra, are you still there?
I am still here. Is this better?
Oh my God, that's so much better. Yes, go ahead.
All right. So we appreciate the extensive data that the county's actually put up regarding confirmed cases, but that information seems much more difficult to come by when it comes to getting breakdowns in regard to death, age, gender information. We appreciate the fact that you did manage to put forward the information regarding the race breakdown. We know that the epidemiology department must be super taxed right now, but is there any way to streamline their work so that as information regarding deaths comes in, we can actually get more clear information about what the demographics for folks who die actually is? Because right now that seems to be very difficult.
There are only a certain number of people who actually can access this information, because you are seeing protected data regarding an individual. So we have limitations on who can actually access it. Once they have the aggregate data, it can be shared, and as I have on the screen right now with the 45 people who died, 30 of them are listed and identify as white, 15 black/African American. There are no unknowns at this point, though we expect as time goes by, if we get more deaths, we'll actually have some in the unknown category. The epidemiologists in our health department have to identify this after the death, because we do not get racial breakdowns for the positive cases. And that's the problem.
Right,
and as a result, it can be a little difficult, because if they go through their Healthy Link sources and the like, and they don't identify a race, then the only way to identify it is to contact the family, which is kind of not really a great thing when they're dealing with the death, to then go and say, oh, by the way, your recently deceased loved one, what was their race? So there are issues with that, and that's why we may not be able to provide it on a daily basis, but we're trying to do updates as quickly as possible.
Right now, I think it's age range and gender data that we have been waiting on for several days now, and so I'm just wondering whether or not there's any way to actually at least periodically provide that.
We tried, and I will continue. As I said, the problem is it's the epidemiologists and the not huge staff of our Department of Health that has access to the information, and when I'm trying to get it, and I understand your need. We did, I think, post earlier today, yes, here's the cases by age and gender. It wasn't the deaths. I will try to get out by the end of the day the ages and genders of all the individuals who passed, so you'll have an actual age, gender, and racial breakdown of the individuals who have deceased.
Thank you.
Mm-hmm. Are there any other questions from members of the media, including those I may not have identified?
Yes, Mark, I had a question about the business task force.
Sure, just who is this so I know?
Yes, I'm sorry. It's Matt Glenn from the Buffalo News.
Oh, hi, Matt.
Can you tell me a little bit more about, how often will this task force convene? I'm imagining they're doing it virtually. And then how quickly are you expected to see some kind of results from them?
Well, the task force will be meeting virtually. They will not be meeting in person. We are practicing smart social distancing, so all of these representatives will be meeting virtually through either phone call or video meeting, video conferencing. My understanding is the first meeting, at least of leadership, is tomorrow. The co-chairs, Scott and Brenda, have had previous conversations with us, but the business task force will be meeting quite a bit. I can't give you an exact date and how many they're going to times to meet a week, but I did talk to Scott earlier, and I talked to Brenda, and one of the things that they wanted to do is to get this information out as quickly as possible, or I should say get information back from businesses, especially on the survey, as quickly as possible, and that'll take a little bit of time, but they also want to get information to businesses as quickly as possible. And I do anticipate that they will be busy over the next month to 2 months at least. I was asked earlier today by one of the chairs, what would I consider a success? Is there a particular time we'd return to? And I really can't give a timeline on what I would say the task force and the work we've done has been successful. I remember coming out of the 2008-2009 recession, it took years to get back to the workforce numbers that we had before the recession. Now we're much higher than that, or we were up until this point with what happened as a result of the coronavirus layoffs. I'm hopeful that we get back sooner rather than later, but I know for every industry it's going to be different. There are some businesses that just won't survive this. So what can we do to ensure that we keep as many businesses alive in the long run is the goal of the task force, to help those that are currently working get the resources they need, including those that are looking to hire, because there's still a lot of businesses that are essential that are hiring out there, as well as the other resources that maybe a business is partially engaged in transactions right now, not fully engaged, but what they need so that they can succeed. I can't give you an exact how many days they're going to meet per week, but I can tell you they're going to be meeting a lot, and their first official discussion starts tomorrow.
Okay, thank you.
Okay, man. If there's no other questions from the media, I want to thank them once again for participation. We've had an hour or so, and I know that there's a lot of things that are going to be going on. The president will probably be coming on a little later too. I just want to remind everybody that we are in the storm, the hurricane. We haven't reached our peak yet, and the peak would some ways be the eye of the hurricane. We're going to be some weeks off until we hit that peak. The numbers that they see in New York City and the declining hospitalizations and new hospitalizations is a very good thing, but we don't necessarily see that here. We're seeing our hospitalizations continue to increase. We're seeing our ICU usage continue to increase, and we want folks to understand that it is not an apples-to-apples comparison between what they're dealing with in New York City in their timeline and what we're dealing with here. And I just want folks to understand that when the governor talks about there being varying peaks, there are going to be varying peaks. We're going to see a peak later than what they're seeing downstate. So we do expect to continue. We are all in this ship of state together, this Erie County, as well as Western New York. It's going to be a little bit more time before we do hit our peak. If we continue to do what's right to flatten the curve, we will have a lower peak than we could have had, and we will have, more importantly, less hospitalizations and less deaths. We are all in this together. We all are brothers and sisters keeper, and I ask you, especially during one of the most holiest weeks of the year, to remember each other. To all those in the Jewish faith who are celebrating Passover, may you have a happy Passover. And as we enter now one of the most holiest members of or times of the Christian calendar, I want to wish everyone a happy Holy Wednesday as we go to a very important day tomorrow, Holy Thursday, and then the remainder of the Easter season. So until tomorrow, may you be safe, may you be well, and once again, we are all in this together, so please act accordingly to protect yourself and your neighbor. Thank you, everyone.